Welcome to The Explainer. All right, today we are going to tackle a topic that's, incredibly common, but one we don't really talk about much, hemorrhoids. So let's just dive right in and clear up some of the confusion, shall we? First things first, if you've ever dealt with this, you are so far from alone. I mean, just look at this number. The data shows that anywhere from 58 to 86% of people will experience symptoms at some point in their life. That makes this one of the most common human conditions out there. Period. So, what are we actually talking about when we say hemorrhoids? Well, to get what goes wrong, we first have to understand the parts that are supposed to be working right. This isn't really a disease. It's more like a normal part of our own anatomy that's just, acting up. Okay, so here's a fascinating fact. Every single one of us has what are called hemorrhoidal cushions. Seriously, everyone. You can think of them as these tiny, helpful little pillows inside the anal canal. They're made of tissue and blood vessels, and they actually have a really important job. They help keep everything sealed tight. Right, so let's be super clear. Having these cushions is totally normal. It's actually necessary. The problem, and what we call hemorrhoids, is simply when these cushions get swollen, irritated, and kind of slip out of place, which is when they start causing all the trouble. Now, there are two main types, and the big difference between them all comes down to their location relative to something called the dentate line. So internal hemorrhoids, they're above this line in a spot where there just aren't any pain-sensing nerves. That's exactly why they're often painless, even if there's some bleeding. But external ones, they're below that line in an area that's full of nerve endings, and, that's why they can hurt. A lot. For the internal kind, doctors actually have a system for classifying how severe they are. It's broken down into 4 grades. Grade I is pretty simple, just some swelling inside. With grade 2, it might protrude when you have a bowel movement, but then it goes back in all by itself. By grade 3, it comes out and you have to manually push it back in. And then there's grade 4, where it's permanently out and can't be put back. This whole grading thing is really just to help figure out the best way to treat it. Okay, so that leads to the big question, right? Why do these cushions get so irritated in the first place? Well, a lot of the time, it really just boils down to one word: pressure. And a whole bunch of different habits and life events can crank up that pressure. And here are the usual suspects. Things like constipation, not getting enough fiber in your diet, and of course, chronic straining. They all increase pressure down there. Same thing with pregnancy, which makes total sense because of the weight of the uterus. And here's one you might not think about: spending too much time sitting on the toilet, even just scrolling on your phone. It lets everything relax, and those cushions can fill with blood. This quote from the source material really just sums up the mechanics of it perfectly. All of that extra pressure causes 2 things to happen. First, the veins inside the cushion stretch out and swell up. That's the venous dilatation part. And second, the tissues holding them in place get weak, which lets the cushion slide downwards. It's a classic cause and effect situation. Okay, so we get the problem, but what about the solutions? Well, the good news is there are a ton of effective ways to manage the symptoms, and many of them start with some really simple changes. And the goals of any treatment are pretty straightforward. Number 1, you want to relieve those immediate symptoms: the pain, the itching, all that discomfort. Number 2, you want to stop things from getting any worse. And number 3, and this is a big one, you want to build habits that keep you healthy in the long run and prevent it from happening again. The first line of defense is almost always lifestyle changes. Seriously, upping your fiber makes stools softer, which means less straining. And you have to drink more water because fiber needs water to do its job properly. Then there's the sitz bath, which is really just a fancy way of saying you sit in a few inches of warm water. It can give you incredible relief by relaxing the muscles down there. And please do not underestimate how powerful these simple changes are. The evidence is it's huge. One major analysis found that just adding more fiber to your diet can cut bleeding from hemorrhoids by about 50%. I mean, 50%. That is a massive impact from something so simple. Now, for more immediate short-term relief, you've got over-the-counter options, and they generally fall into a few different categories. You've got protectants, which basically create a physical barrier. Then you have astringents, like witch hazel, that help dry out the area and relieve itching. And of course, there are local anesthetics that can temporarily numb the pain. Just remember, these are for managing symptoms while the real issue gets better. All right, this brings us to what might be the most important point of this entire explainer. Self-care is great, it's effective for a lot of people, but it is absolutely crucial to know when it's time to stop and go get professional medical advice. And this is why. This quote is so revealing. It says that in some studies, literally half the people who were sure they had hemorrhoids actually had something else going on. Other conditions can totally mimic the symptoms, so getting an accurate diagnosis from a doctor is just, it's everything. So, what are the red flags? When do you call the doctor? Well, if your symptoms aren't getting any better after a week of taking care of it at home, that's one. If you're in severe pain, that's another. If you see bleeding that's dark red or even black, or it seems mixed in with the stool, that's a big one because it could be coming from higher up. And of course, if you have a grade 4 prolapse, all of these are your signs to stop guessing and make that appointment. At the end of the day, it all comes down to this. You can't treat what you haven't diagnosed correctly. Getting a proper evaluation makes sure you're on the right path and, just as importantly, that you're not accidentally ignoring something more serious. And that pretty much wraps up our explainer. I think the biggest takeaway here is that prevention and management, they really do start with small, consistent habits. So I'll just leave you with this question. What's one simple change you can make for better bowel health starting today? Thanks so much for watching.